This video is part of a longer live stream conversation about total knee replacements. In this segment, we're focusing on weight requirements and medical clearances, something many patients, especially plus size and African American patients, encounter before surgery. What you're about to hear comes directly from our lived experiences when navigating this process. One quick note: I am not a medical provider, and this is not medical advice. These are our personal experiences only. Please consult your healthcare professional before making any decisions about your medical care. And y'all, I went probably, I think it ended up being like maybe 3 full months before I even had surgery. They, because I was at a distance, it took a lot of coordination with the orthopedic surgeons to agree to take me on as a patient, using the records of other doctors and their x-rays and stuff. And I was flying back and forth. And then I just, they were like, well, we're not going to take you. It was clear the orthopedic surgeon was not going to take me seriously about doing this surgery until I showed up in his office, right? He looked at my records a little bit, but clearly, right? And I needed this because I needed to put him in my vacation time and medical leave, all those things. So I kind of shut down things and a little bit, and then came on to Texas. And my sister, she had made all of these provisions, and she had set me up at the community center, and they had a great state-of-the-art brand new facility where they had warm water therapy. Oh my gosh, it was just the best place for me, because I went 2, if not 3 times a week prior to surgery to do that underwater aerobics in that warm water. And so easy on my joints. And because the doctor said to me, KendyK, you're not a good candidate, basically. Did you get that conversation? I know people see you now, but you were obese for surgeries 1 and 2.
Yeah. You're right. Hi, Kat. Yeah. So, again, with most surgeries, ideally, you want to be at, optimal health, so that includes things like your blood pressure. They're going to run a bunch of labs. They're going to check your weight. So if you're overweight, which I've been most of my life, um again, that's going to make a surgery harder, and there's a higher risk for complications. I feel like I could have been a doctor like in my previous life, y'all.
Hey.
There could have been, more complications. The more risk factors that you add to the equation. So if you can lessen those, and if you can get at a healthier weight, then likely your surgery outcome and just the process of going through surgery, being put to sleep, going through anesthesia, coming out of it, it's going to be better and easier for you all the way around. And your doctor, your surgeon, they're all about being successful with your surgery as well.
Yeah. They don't want you messing up their stats, right?
Don't mess up their stats. And they care about you too. Like, they don't want to lose someone to, being on the table,
Yeah.
So yeah, those are really great points. Yep.
And it's also, it's not just the excess weight and the risk for surgery, but it's the comorbidities, like you said, San, that come right along with it. It's the blood pressure, it's the anesthesia that is required, it is diabetes. And thank goodness that was probably the only thing we didn't have was type 2 diabetes, but our father had type 2 diabetes,
and all of his siblings. Like, it really does run deep in our line, in our history, in our family.
Yeah. Yes. We're talking everything you need to know about total knee replacements, especially when you show up in the world in our beautiful shades.
So right now, KendyK, I weigh around 115 pounds. And so actually for my height, that's really exactly where I should be, and that's where I try to maintain. KendyK has always been taller than me. So I'm 4'11". But this is really the first time in my
And
life
I'm
ever.
5'4.5" ish. I used to be 5'5", but I've shrunk and after surgery, and we'll talk about that.
We will talk about that. Yeah. And so now, it just having the surgery and being at a better weight, I can exercise easier. I can do house chores easier. I can bake easier. Like it really has made everything easier. The knee replacements and losing the weight.
Mm-hmm, mm-hmm. Has we grew up as those beautiful girls with those smiles, but we were fluffy girls, right?
Oh yeah.
And so to see my sister at what's your current weight range now?
I'm at 115 pounds. 115.
Wow, that I've never seen you that small. I don't recall you ever in life being that
I'm telling you, it's the first time I've been at go weight in my life.
well, honey, you are looking 51. No, are you
51.
51? Yeah, 51 and fabulous. I had to think now, are we friends? It's like this. Total knee replacement is the most common joint replacement surgery, elective surgery performed in the United States. And this is according to the American Academy of Orthopedic Surgeons. Can you believe that? It's not hip replacements, it's not rotator cuffs, and Sandy has had a couple of rotator cuff surgeries as well, but it's the total knee replacement. So y'all drop in the chat. Let me know if you know someone or if you yourself has had a total knee replacement. And the surgeon was real clear with me, saying, KendyK, if you cannot go home, if you're not ambulatory, meaning walking and moving good, then I'm sending you straight to the rehab center because you are too young not to get up from this surgery and be in a good place. So I was like, okay, well, I got to work hard. And I remember when they
And
got
you
me up,
did.
huh?
You did work hard too.
Oh, thank you, sir. And when I did get home, when I did get up right after surgery, you're going to get up out of that bed on day one. They are going to get you up, and what got me up is I had to go to the bathroom, and so they got me up, and they were like, "Oh, we're walking to the bathroom," and I'm like, "Oh man!" And y'all, when I got to that restroom and sat down, do you know I bawled like a baby because it was
Painful.
so much pain
Painful.
and huh?
Painful.
Painful now because you just got cut. Now you just got cut. I remember the pain block, and I remember that saying you pre-surgery we're in the pre-op space, and surgeon comes in with his assistant, and they came to do the markings on the leg, and I was a nervous wreck, and Sam's just cracking all kinds of jokes, laughing, smiling. Everybody's connecting with her because she's now had two surgeries from this same orthopedic surgeon. The whole hospital knew her. And, because they do them all on one specific floor and all of that. And so then the surgeon is like, okay, I'm done with my markings. He's like, do you want to take a look? And I was scared to even look at the markings. And I looked down, and it was a happy face because he just simply needed to mark the leg that they were going to put the knee replacement in, and that made me laugh. Yeah. And that made me laugh. So I laughed, and then came the pain block. Now, Masua had shared a whole lot of background information, but she did not tell me what applying that pain block was going to be like. I mean, I hollered when they stuck that needle in my knee. And it lasts for
Did you look at the needle?
I don't know. I was ready for surgery. I mean, I had to shed weight. The doctor told me, "Oh, I won't even do your surgery until you shed some of this excess weight." And I shed right at 40 pounds. I
You
shed
did.
right
You
at
did
40.
really good.
I
I
stayed
remember.
right at 40 pounds because that's all I did. I was working by day and then would take breaks and get down there to that warm water pool and do those aerobics with those fabulous women and men, most of them twice my age, having total knee replacements, hip replacements,
Oh
all
yeah.
of the things. And KendyK was right in that water with them and all of that. Sandy, would you do it again? 3 knee replacements.
hmm So, KendyK, if you're asking me if I would have a fourth knee replacement, heck yeah. I am not scared of surgery. I'm not scared to be put asleep. You already mentioned that I tore my rotator cuff. Not only did I tear it, I tore it twice. And so I had to have rotator cuff repairs twice. Um, which was crazy. Honestly, even though knee surgery is painful, rotator cuff recovery was much more painful than that. I would do it again, and that's why I can, really boldly encourage people. If you feel like you're having a lot of knee trouble, it's not something that you have to suffer through. Um, oh, thank you, Evie.
Let's end on this. Let's do a quick 5 to 7 minute deep dive on this issue here, which is really pressing for so many. They won't give low carb queen a total knee replacement because of weight. Did either of you have this experience? It absolutely was my experience. The orthopedic surgeon said no. And Sandy alluded to it. She said they don't want to mess up their stats. Not on their watch as the surgeon. They don't want to be the one who's patient. When you have, when you are obese, morbidly obese, overweight, with it comes the comorbidities. Sandy, did you have that experience? Share that with us.
Yeah, no, I didn't. I was certainly obese at the time. Definitely over 200 pounds, and still was able to have my surgeries without losing any weight. I know that's not everybody's experience because, like you said, every doctor and every surgeon is going to be different, and they may have different expectations. So if you do have to lose weight, know that you can do it, and know that first of all, you don't want your knee surgery to fail. Like you don't want the new instrument, the new knee that they put in. You don't want it to fail because you're too heavy and you can't do your exercises, you can't do your therapy, and you're in too much. Like all those things come with excess weight. So if you do need to lose weight, there's so many things out there now that work. Go talk to your doctor, find out, if you can get some medicines, there's shots,
Mhm.
there's pills, there's all kinds of things that you can do. Hopefully obesity, in the future, near future, is no longer this thing that we just have to have. I believe obesity is a disease.
It is.
I don't think it's something that none of us want it, or try to achieve or anything like that. I think it's a disease, and your body's temperature and limits as far as what you eat, it's off, compared to like normal weighted people or average weighted people. And so now at 115, my desires for what I eat is different.
You
Because
still love them sweets. Y'all, it
I
was my
know.
son. It
Look,
was my son
I'm still
who
eating
taught
cake.
me how to go into a fine dining restaurant, and we're gonna start our meal with the dessert. Both, I absolutely had that experience, and the orthopedic surgeon said that he would not take me as a patient until I shed weight, and so I visited Dr. Lou, and she was able. Shout out to Dr. Lou for advocating and sitting down with me face to face in a chair and talking to me, and I told her what I needed to do, and she understood and put me on or phentermine as a the pill, because that I know GLP-1s were not even available. I'm
They
talking
were available to us. They were available.
and there it is, and there it is, and there it is. Wow. I'm at a loss for words. So yeah, so that's what I use to shed the weight. But My sister, she would have me on a high protein, low carb, high fiber diet, baby. She had me on a high protein, low carb, and high fiber diets, and I appreciate you. So that was just a sincere act of genuine kindness to just y'all. I was at her home before what 5, 6 months, and y'all, it wasn't anything nice. One thing I knew for the sure is we can never live together as one grown woman per household. Yeah, you got to advocate for your own health care, and so it's important to ask for these things. And I don't think our orthopedic surgeon, we're not going to say his name, but I don't think for surgeries 1 and 2, and who did my surgery, so that makes 3 surgeries that he did for us. I think with him, with his slim build, like your genetics gave you a slim build, right? And therefore you don't understand
No, it's not even
what
something.
that means to tell me that you need and are requiring me to lose 50 pounds.
Like Oprah Winfrey said, they don't even think about it.
Yeah, and
They never had to
be thinking about it, not the way in which you just let that roll off your tongue. And I'm like, well, it'll be, I will be 50 by the time I lose, 50 pounds for a surgery, but because, I did have a caring doctor in my primary care doctor, and also I did employ a dietitian. That's where I learned about dietitian, because y'all, most of these programs, think about it, insurance is big business. They want us to be healthier, so they are willing to put out those costs for weight loss programs. I was in some program that was free from my insurance, where they sent me a scale, they sent me a pedometer to count my steps, and all this stuff was free of charge. And these conversations are just part of a larger live stream about total knee replacements. If you want the full context and the complete live stream in the rest of this series, they're linked below. And if this resonated with you, feel free to share your experience in the comments. You are not alone. Please like, comment, and subscribe so you don't miss the rest of this series. Yeah, it's that time again, we shine again. From Memphis to the Northwest wind. It's love, it's life, it's every day. You KendyK all day. Morning light, coffee in hand. Making moves with a master plan. Simple things make the spirit stay. We find our joy in the everyday. Keep it real, that's the only way.